There is nothing a pregnant woman thinks about more than the moment that she's going to deliver her baby. But finding a doctor to see her through those 9 months is getting harder and harder because obstetricians are being pushed out of the delivery room. Tonight, News 10's Alicia Streeter looks at why OBs are calling it quits.
Sorry, baby.
It is the best sound. There's no other sound like that. It's the best.
Dr. Laura Costello loves hearing the newborn's first cry, but after July, it will be a sound she rarely hears. Dr. Costello is giving up obstetrics to focus solely on gynecology in her Albany practice.
Taking care of patients takes a lot, and it comes to a point where sometimes you're taking better care of the patients than yourself.
Because taking care of pregnant moms means you will deliver babies on nights and weekends, an exhausting schedule that has pushed many OBs to quit in their 40s and 50s.
I am no longer hanging on by my fingernails. I had just reached the point where I couldn't physically and emotionally do it.
Dr. Mary McGinnis quit delivering babies last summer. She no longer gets a migraine headache before she goes on call. And the cost of her malpractice insurance dropped significantly.
$55,000 to $11,500.
That is a big part of the problem. According to the American Congress of Obstetricians and Gynecologists, or ACOG, 15% of OBs have decreased the number of deliveries because of the cost of malpractice insurance. Why is that so necessary? Because 95% of New York OB-GYNs have been sued at least once during their career. 50% of New York OB-GYNs have 4 or more claims against them.
Everybody wants a perfect baby. Why isn't my baby perfect? And if it isn't, then it's got to be somebody's fault.
Usually that finger points to the OB, and ACOG says that is why several area practices have had a hard time recruiting OBs.
In New York State, generally, the fear of being sued is so great.
So what is the answer to keep OBs in business? There are many different solutions.
I think the first thing is, and some hospitals are already doing it, have laborists, people that just stay in the hospital and do labor and delivery.
That would cut the cost of malpractice insurance for the doctors and give OBs a better quality of life. Changing New York's malpractice laws won't be such an easy fix, but Dr. McGinnis and Dr. Costello made their own changes, and they couldn't be happier.
More time at home and definitely more set hours. A good night's sleep.
I really am enjoying my practice more, enjoying my patients more. I'm not short-tempered, I'm not crabby.
Alicia Streeter, News 10.
And both Dr. McGinnis and Dr. Costello have other doctors in their practices who do obstetrics, and Bellevue Hospital is developing a laborist program that will be in place by this summer, and that will be the first in this area. And when that program is up and running, we're going to take a closer look at how it's working and how much it will help local OBs.